Hello everyone and welcome back to Mary Notes for Medicos. The topic that we're going to deal today is candidiasis from bloodstream infection. The objectives are introduction, the predisposing risk factors, clinical features and pathogenesis, lab diagnosis and the management. So what is candidiasis? It is an opportunistic endogenous fungal infection. It is also known as the most common fungal infection which is caused by Candida albicans. So the predisposing risk factors are extremes, that is children, pregnant women, old people. Immunosuppressed patients like patients having HIV, cancer, patients undergoing dialysis, etc. Then diabetic patients or diabetic individuals, then undergoing drug therapy like steroids, immunosuppressants, excessive antibiotic therapy, etc. So what are the clinical features and pathogenesis? So the pathogenesis is basically dependent on cutaneous candidiasis, mucosal candidiasis, intestinal candidiasis, bronchopulmonary candidiasis, and bloodstream infection or COTI and systemic infection. So these are the types on which basis the pathogenesis is defined. Cutaneous candidiasis, it is occupational. So basically it occurs because on nails, for example paronychia or onychomycosis, and the symptoms is that it shows erythematous scaling or moist lesions and it is sharply demarcated in the bodies. Next is the mucosal lesions. Here the fungi affects the mucosal region, for example like oropharynx, esophageal region and vagina. So oropharynx candidiosis and oropharynx candidiosis is also known as oral thrush, and this is basically seen in bottle feeding infants. Esophageal candidiasis, they are seen in HIV and immunocompromised patients, while vaginitis or vulvovaginal candidiosis is very common during pregnancy. The next is intestinal candidiasis. This is massively seen when a patient is undergoing a long time or long antibiotic therapy, and they might present with diarrhea and they don't respond to any antibacterial treatment. Next is a bronchopulmonary candidiasis. This is a very rare complication, but it occurs in pre-existing pulmonary or systemic diseases. Next is a bloodstream infection or COTI. Both occurs due to catheter colonization. Systemic infections, it might be because of septicemia, endocarditis, meningitis, terminal complications in diseases such as leukemia, and sometimes it can be because of immunodeficiencies manifestation, for example like candida granuloma and chronic mucocutaneous candidiosis. So what are the lab diagnoses? We would be taking the sample of blood and urine. For microscopy, we'll be doing gram staining and we would be seeing positive gram bacteria having candida yeast with pseudo hyphae and pus cells in the tissue. When we do culture, we can do only on sabo or a dextrose agar, that is SDA, and we will be seeing uh, creamy white, smooth and yeasty order uh, culture there. Next, we can also do a gram tube cell testing. This culture is tested with sheep serum or human serum, and they form bird tube cells, and this shows positive for Candida albicans. Next is the Dalmoplate test. This also, if it is positive, it gives a positive sign that the patient has been infested with Candida albicans. Corneal agar culture, it forms chlamydospores at 20 degrees Celsius. In inoculation, the species can be differentiated on the basis of their growth patterns, colors, etc. In chrome agar, green colony shows the presence of Candida albicans. For serology, there is a new form of serology that has come, that is 1,3-beta D glucan assay. Along with that, we can also go for ELISA and RIA, and also we can go for a skin test. Here they would be showing delayed hypersensitivity because of the CMA function indicator. Next is the molecular method. We can do DNA probes or PCR method. for microbial identification, Malditov and Vitek. So what are the method of management? The prevention method is we can eliminate all the predisposing factors, and the treatment is we can give them amphotericin B or fluconazole, ketoconazole or micafungin. So that was the video. I hope you like this video. If you like this video, don't forget to like, share and subscribe to our channel. We'll be coming with more videos. Still then, stay tuned. Happy learning. This is Ashna Viraj signing off for today. Bye.